Mongolian spots, also called congenital dermal melanocytosis, are flat blue-grey or blue-green skin markings that are usually present at birth or appear shortly after birth. They are completely harmless in the vast majority of cases and are especially common in babies of Asian, African, Native American, Hispanic, and mixed ethnic backgrounds. These marks are not bruises, not infections, not signs of disease, and not caused by poor health or nutrition during pregnancy. They happen because pigment-producing cells called melanocytes become trapped deeper in the skin during fetal development. Normally, melanocytes move toward the upper layer of the skin before birth. In Mongolian spots, some of these cells stay deeper in the dermis. Because light scatters differently through the skin, the pigment appears blue or grey instead of brown. One fascinating medical fact is that the blue appearance is caused by something called the Tyndall effect. This is the same optical effect that helps explain why the sky appears blue. When pigment sits deep beneath the skin surface, shorter blue wavelengths of light scatter back toward the eyes more strongly. Mongolian spots are most commonly found on the lower back, buttocks, shoulders, or hips. Some are small, while others can cover larger areas. Their shape can be irregular, smooth, or slightly diffused. Doctors usually diagnose Mongolian spots simply by looking at them. In healthy babies, they are considered a normal skin variation. Another important fact is that these spots almost always fade naturally over time. Many become much lighter during early childhood, and a large percentage disappear completely before adolescence. Because Mongolian spots are harmless and often temporary, medical treatment is usually unnecessary. There is currently no scientifically proven natural food, herb, supplement, cream, or detox method that can remove Mongolian spots permanently. Claims that specific diets, juices, oils, or herbal remedies can cure them are not supported by reliable medical evidence. However, healthy natural skin support can still help the skin remain calm, protected, and healthy overall, while the body follows its natural fading process. One of the most important natural approaches is protecting the skin barrier. The skin barrier is the outer protective layer that keeps moisture in and irritation out. Healthy skin tends to recover and regulate itself more efficiently. Simple natural skincare habits can support overall skin health. Keeping the skin moisturized with gentle, fragrance-free products. Avoiding harsh scrubs or aggressive rubbing. Protecting the skin from unnecessary irritation. Supporting general health with balanced nutrition and hydration. Foods rich in vitamin C, vitamin E, zinc, and antioxidants help support normal skin function. These nutrients are found naturally in foods such as oranges, strawberries, kiwi, spinach, almonds, sunflower seeds, carrots, sweet potatoes, beans, fish, and leafy greens. Vitamin C helps the body produce collagen, an important structural protein in the skin. Vitamin E acts as an antioxidant that helps protect skin cells from oxidative stress. Zinc supports normal skin repair and immune function. Healthy fats from foods like salmon, walnuts, olive oil, and avocados help support the skin's natural moisture barrier. Another interesting fact is that human skin constantly renews itself. Skin cells in the outer layers are regularly replaced, although deeper pigment cells can remain for years. Some people seek cosmetic treatment when Mongolian spots persist into adulthood or appear in visible areas. The most studied medical option for reducing persistent dermal pigmentation is laser therapy, especially Q-switched lasers. These lasers target pigment cells while minimizing damage to surrounding tissue. Laser treatment is not required medically for typical Mongolian spots, and many dermatologists recommend simple observation because the spots often fade naturally. It is also important to understand the difference between supporting healthy skin naturally and claiming to cure a congenital skin condition. Good nutrition and gentle skincare support overall wellness, but they should not be presented as guaranteed cures. Another fascinating medical detail is that Mongolian spots are sometimes mistaken for bruises because of their colour. This has occasionally caused confusion in medical and social situations. Paediatricians are trained to recognise the difference. Bruises usually change colour over days or weeks and may be painful or swollen. Mongolian spots are painless, stable in appearance, and present from birth. Researchers have studied Mongolian spots for decades. Studies show that prevalence differs widely among populations. In some East Asian and indigenous populations, they appear in the majority of newborns. Scientists also believe genetics plays a major role in determining who develops these marks. Despite their dramatic appearance in some babies, Mongolian spots are not skin cancer and do not normally become cancerous. Parents are often reassured to learn that these marks usually do not affect the child's health, intelligence, growth, or development in any way. In rare situations, extensive or unusual dermal pigmentation can sometimes be associated with certain metabolic or genetic disorders, but this is uncommon and usually accompanied by other symptoms. That is why persistent, widespread, or unusual skin markings should always be evaluated by a qualified healthcare professional rather than diagnosed through social media videos or unverified internet advice. The safest and healthiest evidence-based approach is understanding that Mongolian spots are usually benign birthmarks that often fade naturally over time. Gentle skincare, balanced nutrition, hydration, sleep, stress reduction, and sun protection support overall skin health naturally. But no natural remedy has been scientifically proven to erase Mongolian spots completely. One final interesting skin fact. The human body contains millions of melanocytes, and these tiny cells are responsible not only for skin colour, but also for hair colour, eye colour, and part of the skin's natural protection against ultraviolet radiation. The deeper one studies skin biology, the more there is to be discovered how incredibly complex and intelligent human skin actually is, and that modern medicine still has a lot to learn and discover about it.